Heart failure can involve the left side, the right side, or both sides of the heart. Left-sided heart failure is most commonly caused by left ventricular dysfunction, but it can also be caused by other abnormalities like mitral or aortic valve dysfunction, cardiomyopathies, and congenital heart disease. The ejection fraction is used to describe the pumping ability of the left ventricle. It measures the percentage of blood pumped out of the left ventricle with each contraction. The ejection fraction in a normal heart ranges from 55 to 70%. If the pumping ability of the heart is impaired, the ejection fraction is decreased. There are three types of left-sided heart failure. Heart failure with reduced ejection fraction, or HFrEF, heart failure with preserved ejection fraction, or HFpEF, and heart failure with mid-range ejection fraction, or MEFrEF. Heart failure with reduced ejection fraction, or HFrEF, is also known as systolic heart failure. It's defined by an ejection fraction of 40% or less. The most common causes of HFrEF are coronary artery disease, idiopathic dilated cardiomyopathy, hypertension, and valvular disease. We'll talk about these in more detail in a later lesson. In HFrEF, the left ventricle is dilated and the heart muscle is weakened. So the left ventricle doesn't contract effectively, and less blood is pumped out to the body. As a result, oxygenated blood coming back from the lungs builds up in the pulmonary veins and fluid backs up in the lungs, causing pulmonary edema. Pulmonary edema causes shortness of breath, also called dyspnea. Dyspnea often occurs when the patient is exerting themselves or when they're lying down, in which case it's called orthopnea. Pulmonary edema also causes coughing and fatigue. If not treated promptly, pulmonary edema can lead to respiratory distress. The second type of left-sided heart failure is heart failure with preserved ejection fraction, or HFpEF, which is also known as diastolic heart failure. It's defined by normal or preserved ejection fraction of 50% or higher. The most common causes of HFpEF are hypertension, coronary artery disease, diabetes, hypertrophic obstructive cardiomyopathy, and restrictive cardiomyopathy. HFpEF develops when the wall of the left ventricle becomes stiff and thickened. It can no longer fully relax during diastole. So the amount of blood filling the left ventricle is smaller than normal. Even though the heart muscle cannot relax as it should, the left ventricle is still contracting normally. So the ejection fraction, the percentage of blood pumped in each contraction, is preserved. But the absolute volume of blood per beat is decreased, meaning the heart is unable to meet the body's needs. HFpEF is more difficult to diagnose than HFrEF. HFpEF is most common in women and older people with comorbidities, so keep it in mind when evaluating these patients. There's also a newer third classification of left-sided heart failure, known as heart failure with mid-range ejection fraction, MEFrEF. This encompasses heart failure with an ejection fraction of 41 to 49%, and it has characteristics of both HFrEF and HFpEF. In the next mastery lesson, we'll talk about classifying patients with right-sided and biventricular heart failure.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope to see you again soon.